Hello everyone! Today we are going to talk about mouth and teeth health. And to be more specific, we are going to discuss periodontics. I'm Queenie, and before we start, please subscribe to our channel so next time you'll be updated with our new releases. Periodontics is a branch of dentistry that exclusively deal with the supporting structure around the teeth that are known collectively as the periodontum. The term is derived from the Greek language. Peri means around and odont means tooth. Periodontist focuses on the inflammatory diseases that destroy the gums and another supporting structure around the teeth. A periodontist is a dentist whose specialties is mainly the prevention, diagnosis, and treatment of periodontal diseases and the placement of periodontal implants. The periodontist is also the expert in the treatment of inflammatory diseases. A periodontist examines the gums to check if there is gum line recession, assess how the teeth fit together while biting, and check the teeth to see if they are loose. He or she will also take a small measuring instrument or probe and place it between the teeth and gums to measure the depth of those spaces, called periodontal pockets, and all of that is done to assess the health of the gums. Hello, Dr. Lee. How are you?
How are you?
I'm Queenie. So, thank you for visiting us today. So, can you introduce yourself to us?
Hello, I am a dentist. My name is Chang-Min Lee. I graduated from Yonsei University Dental School. I took the exams to qualify as a periodontist in both the USA and Korea. Currently, I am a licensed periodontist. Now I work at a Good Life Dentistry, seeing patients on a daily basis.
So, Dr. Lee, you said you're a periodontist?
Yes.
So, what is a periodontal department, and what makes you specialize in it?
Simply put, a periodontist takes care of issues affecting the dental gums. For example, as many of you know, scaling. Scaling is a non-surgical method to take care of the dental gums, which we do. We also do deep scaling, which requires local anesthesia. Through deep scaling, together with anesthesia, we get rid of scaling built up between the gums and teeth, as well as infections. And in cases where the gum disease is severe, we also do surgery. Like we said, scaling and deep scaling are non-surgical techniques to care for gums, and gum surgery is for removing parts of the gum that are infected. In cases where the gum disease keeps reoccurring even after treatments, leading to the need to remove the teeth, or when a patient is missing a tooth, we install implants. So, taking care of the gums, performing surgery when needed, and even performing implants is what a periodontist does. We can also add that we can aid the healthy development of gums. We even carry out grafting of gums, a surgical procedure, combining care, maintenance, and in some cases replacing the teeth with a replacement or implant is what we do. We can also add we help take care, maintain, and ultimately give freedom to those who follow our regimen is our ultimate goal. The reason I studied periodontics is because after I graduated from college and worked at a dental clinic, I realized that the most important aspect is to help take care of the patient's teeth and gums. And if they are missing, replace them and help them to recover are the most important aspects of why I studied periodontics and became a periodontist.
So, Dr. are you currently in charge of the periodontal related treatment at your dental hospital?
The short answer is yes. But our hospital has 5 or 6 head doctors doing their specialties. Each of their specialties are different. So we have dentists and orthodontists. So each of us communicate and try to tailor the best treatment for each patient. So like I said, the basics of periodontics, namely scaling, surgically scaling, and implants are done to the specific needs of each patient. The most important thing is to guard one's dental health and to maintain healthy teeth. For those without teeth or those with needs to remove them, we offer the implant solution and help keep a normal, healthy lifestyle. Thus, I help patients in various ways to maintain their healthy teeth here at the clinic.
So implant. It has been really trendy lately.
Yes.
But what should patients and doctors consider before getting it?
Nowadays, information is plenty on the internet. If one types transplant or implants, there is much information. While the majority of information is correct, what the patient needs to know is more or less readily available. However, if I explain simply, if one needs to have one tooth implant or many teeth implants, there are rather many issues one needs to consider. For example, the ampleness of the bone structure that can support the teeth, implant, is needed. The implant needs a certain minimum bone structure base to support the implant. If the bone structure is too shallow or too small, we need to first supplement it through grafting. A key issue for us is to decide whether to graft the necessary bone structure prior to implant surgery or simultaneously in conjunction with the procedure. Or should we carry out the procedure without bone grafting? These are the issues we must consider. Also, we just talked about the quantity or ampleness of the supported bones, but we must also consider the current condition of the bones. Also, the overall health of the patient is important. So even if we are simply doing one tooth implant, we must plan according to each patient's conditions and needs to carry out the best result. Also, patients also need to consider many issues. For example, a patient might think to simply get an implant, but after doing so, it is important to take care of the implant and the crown. Patients need to take good care of their health. For example, those who smoke should cease smoking and cut down on drinking. So having an implant is not the end of the process, but the start of a new life, which carries many responsibilities.
So how should patients take care of the implant?
Like I said, patients should realize getting an implant is not the end, but a new start. Many think that they can stop visiting the dentist after getting implants and go on eating normally and suddenly are faced with implants that are not stable and move, and thus ultimately suddenly visiting the dentist. Instead, patients should think of their implants as their own teeth and accordingly take good care. Even implanted teeth can have illnesses. If implants are not well taken care of, the surrounding gums can deteriorate and even have infections just like normal teeth. I tell 3 things to all my patients, whether they have normal teeth or implants. First, the correct treatment we give to our patients is key. Second, the care patients do on their own at home when not at a dental clinic. Basically, how they brush their teeth and gums as well as flossing. Third, regular checkups. So, the work is not over after visiting the dentist. It should be supplemented with good care at home and with regular checkups to the dentist. Some issues arise even with good self-care, so we can catch those issues during regular checkups and prevent worse outcomes with timely treatments. So once again, our dental treatments, the patient's self-care, and regular checkups for diagnosis and prevention needed to be dutifully kept. Not only for natural teeth, but also for implants in order to use them for a long period.
So when you first introduced periodontics, you have mentioned gum transplantation
Yes.
as a periodontal surgery. I think there's not much people familiar with it, so can you briefly explain it for us?
In reality, many people are well aware of procedures and issues like gum disease, scaling, gum treatment, gum surgery, implant, sinus lift, However, gum tissue grafting, or pre-prosthetic periodontal surgeries, are terms not many have heard of. If we first start with gum tissue grafting, which applies to both natural and implants, there are two types of gum tissue that hold the teeth in place. The harder type called gingiva and the looser gum called the alveolar mucosa. If we move air in our mouth, we can feel there are tissues that are flexible and tissue that is tougher and immobile. Those tissues hold the teeth in place and also prevent the encroachment by bacteria. But if the gingiva is absent, when the cheeks are pulled, the teeth will follow the movement and temporarily create an air pocket or bleed when brushing teeth if the gingiva is weakened and thus add to the chances of developing gum diseases. In such cases, we can perform gum tissue grafting from the root of the patient's mouth, resulting in a stronger gum tissue base to hold the teeth securely. This is called gum tissue grafting. We can also use grafting techniques for pre-prosthetic periodontal surgeries. For example, there are patients who have too little height in gums, exposing their teeth and subjecting to excessive coldness in their teeth. Some have their gums dug during brushing, which results in gum recession and pain. Some complain about pain, and some worry about their excessive gums in aesthetic terms when smiling. There are many with these issues. Some common treatments are to remove some of the tissue or use medicine to lessen the pain. In pre-prosthetic periodontal surgery, we can graft tissue to raise the gum line and limit the pain as well as add to the psychological satisfaction when the new smile looks more normal in terms of the proportion of the gum and teeth showing. So gum tissue surgeries are also helpful for psychological reasons. Also, if we see other people or actors on TV, we can occasionally see people with too much gum tissue, which shows during their smiles. The smile lines can show their gum tissue. For some, the gum line covers more of their teeth than normal, which is the opposite condition than prior discussed. If we assume the normal line for the gums to show is around here, some have it even lower and covering more of their teeth, which ends up showing more of their gum than normal. While this is not common, there are quite a few who have such conditions. However, many are not even aware of it. But if it is treatable by periodontists, we can remove some of the gum tissue and limit the gum line exposure when smiling. In cases where this is not possible, we can achieve similar results by using laminates or crowns to increase that size of the teeth and results in a normal look. Some need a combination of procedures. If any in the audience has gums that are excessive, you can go to the periodontist and have a thorough exam so we can see if there are any options to consider.
네, 여기까지입니다. Thanks for today. 네, 감사합니다.
감사합니다.
Thank you.
Dr. Lee is a periodontist at Good Life Dentistry in Seoul. A periodontist might perform deep scaling for your teeth to keep your teeth and gums healthy by preventing inflammatory conditions. Periodontists also perform surgery in cases where the gum diseases are severe by opening the gum tissue. Also, when the teeth become unusable due to the severe cavities, a periodontist can perform dental implant to recoup the normal function. In some cases, when gum tissue implants or grafting are performed for patients with gum recession. When performing implants, it is important to assess the bone mass that can support the implant insertion. If there is lack of depth or size of the bone mass necessary for a successful implant, it has to be supplemented with bone grafting. A periodontist will assess if bone grafting is necessary prior to perform implants, while performing implants or without. Once an implant has been performed, it is important to care for the implant and the crown. Smoking should be ceased and alcohol intake should be limited. Gum disease can occur in areas of implanted teeth. just as with natural teeth. So continuous care of the new implant is necessary. The implant should be regularly cleaned by brushing thoroughly and flossing supplemented by regular visit to the periodontist. When gum tissue grafting is necessary, it can be harvested from the roof of the patient's mouth and graft where necessary. Treating gum recessions are not only for medical reasons, but also for psychological well-being, as some may feel shyness when smiling if recession is extreme. In some rare cases, partial removal of gum tissue is performed for patients with overextended coverage of their teeth. Alternatively, the same condition can be also corrected by using crowns and laminates. Until next time, stay safe and see you once again at CloudHospital TV for more video on a wide variety of topics that may be of interest to you.